What do you do if you have pain that shoots or radiates down the back of your leg? I'm Dr. David, orthopedic surgeon, sports medicine specialist, and author of the book, That's Gotta Hurt, The Injuries That Changed Sports Forever. I provide education, information, and commentary on all sorts of sports and exercise, injuries, injury treatments, and injury prevention for athletes and active people so that you can stay healthy and perform your best. A lot of times when we think of the back of the thigh or buttock or even down the leg, we're thinking, piriformis issues or hamstring or calf injuries. But a lot of times, pain that radiates, that shoots down the back of your thigh, into your calf, and even into your foot and toes, is a sign of a lower back problem, a lumbar spine problem, like a herniated disc. It's typically a sciatica, the big nerve that's formed from the nerve roots of your lumbar spine, forms a big nerve that runs down the back of your thigh. And it can be really important to know that because it's a really difficult problem. But especially in addition to pain radiating down the back of your leg into your foot and toes, things that you look for are things like numbness, tingling, even weakness with trying to push a gas pedal or push your foot down or push or pull your foot back, your toes back, things like that. So those are even more potentially worrisome neurologic signs. I think the key is if you try things like Advil or Aleve or other anti-inflammatory medications for a few days, you try rest, things like that, and it isn't getting better, or certainly if you have some of the neurologic symptoms, it might be worth seeing a spine doctor or a spine surgeon to get it checked out. A lot of times it can be physical exam and maybe physical therapy, but maybe they get an MRI. Maybe they do nerve conduction studies to find out exactly what the damage is and what it's going to take to get you better. Hopefully it's not something surgical, but I think the sooner that you can find that out and get started on the road to recovery, that's potentially a good thing. Okay, have you dealt with pain that shoots down the back of your leg? How did it develop? What did your doctor do to make the diagnosis, and what did it turn out to be, and how did you get over it? I'd love to hear your experience. In the comments below, describe your experience. I'd love to read them, and I bet people watching all around the world would as well. I can't answer those questions that you leave there for legal reasons, but I'd love to hear your experience. I would also love to know the number one challenge you're dealing with your injury, be it leg pain or anything else. In the description box below this video, the very top link will take you to a page on my website where you can write all the information you want about how difficult your injury is and why. That information helps me better understand what you're dealing with, so I can design courses, programs, or create videos or articles that can better help you. I think it can be really helpful, but I need to know what you're dealing with to create that content. If you like videos like this and you want more information on sports and exercise, injuries and injury treatments and injury prevention, subscribe to my YouTube channel. I record several of these videos every single week, including roughly a monthly Ask Dr. Geier live video where you can ask me questions if you're on YouTube at that time. And basically you'll get all of that if you subscribe. So click the subscribe button in the upper right corner of my YouTube channel. Thank you so much for watching. I hope this video was helpful, and I look forward to seeing you right here next time.